Dr. David Hayes' heart palpitations. It's not what you think. If your heart suddenly skips, flutters, or pounds, most people immediately think something is wrong with their heart. But in many cases, it's not heart damage. It's an electrical problem. Your heart runs on an electrical system, and that system depends on electrolytes. Electrolytes are minerals that allow electricity to travel through your nervous system and control the rhythm of your heart. Unfortunately, when people experience palpitations, most doctors only check the structure of the heart. They run tests like an EKG or an echocardiogram, and in many cases those tests come back completely normal. So the patient is told something like, "It's probably just stress." But the real issue is often related to electrolytes, and one of the most important electrolytes involved in heart rhythm is magnesium. Before we go further, let me make something very clear. If you experience chest pain, fainting, or you already have diagnosed heart disease, you should always get checked by a doctor immediately. But for many people who experience occasional palpitations, the problem may not be structural at all. So what exactly is a palpitation? A palpitation is simply an irregular heartbeat. It can feel like a skipped beat, an extra beat, or a sudden pounding sensation in your chest. Some people feel short of breath. Others may feel slightly dizzy. But in many cases, the underlying issue is an unstable electrical rhythm. This doesn't mean your heart is failing. It means the nervous system controlling your heart may be irritated. And often, that irritation is chemical. One key mineral involved in this process is calcium. Calcium causes the heart muscle to contract. But when calcium activity becomes too strong, it can overstimulate the nervous system. This overstimulation can lead to symptoms like muscle twitches, cramps, anxiety, insomnia, and even heart palpitations. This is where magnesium becomes extremely important. Magnesium acts as a natural regulator of calcium. It helps balance nerve activity and stabilizes electrical signals in the body. Magnesium also helps relax muscles, calm the nervous system, reduce anxiety, and improve sleep. However, magnesium deficiency is very common, and one of the reasons it's often missed is because standard blood tests rarely detect it. About 99% of magnesium in the body is stored inside cells, not in the blood. So blood tests may appear normal even when the body is actually deficient. Several factors can increase the demand for magnesium in the body. Stress is one of the biggest triggers. When you experience stress, your body releases hormones like adrenaline and cortisol. Magnesium helps regulate these stress hormones. But if magnesium levels are already low, stress can quickly push the body into a deeper deficiency and trigger palpitations. Poor sleep can also increase the need for magnesium. Blood sugar problems, such as diabetes or prediabetes, can also increase magnesium demand. Hormonal changes may play a role as well. Another important factor is exercise. Exercise requires a large amount of energy, and magnesium is essential for producing energy in the form of ATP. When you exercise, your body uses up ATP rapidly. This increases the need for magnesium. Sometimes people notice palpitations shortly after exercise, which can be related to this increased demand. Magnesium can also be lost from the body. Caffeine, found in coffee and tea, can increase urination and lead to magnesium loss. Alcohol can also increase magnesium excretion. Heavy sweating during exercise can lead to the loss of electrolytes, including magnesium. Low-carbohydrate diets or fasting may also cause the body to lose fluids and electrolytes, which can trigger palpitations in people who are already borderline deficient. Another factor is diet. In the past, people obtained minerals like magnesium from natural water sources such as wells or springs. Modern city water contains very little magnesium, and many modern diets are low in magnesium-rich foods. Good sources of magnesium include leafy green vegetables, avocados, certain nuts, and dark chocolate. The green pigment in plants, called chlorophyll, actually contains magnesium at its center. However, many people consume large amounts of ultra-processed foods. When foods are heavily processed, many nutrients are removed. These foods provide calories but very few minerals, and digesting them can actually use up the body's nutrient reserves. Magnesium is often one of the minerals that becomes depleted. Magnesium levels in the body also follow a daily rhythm. Levels tend to be lowest in the early morning hours. This may help explain why muscle cramps and even heart attacks are more common in the early morning. In some cases, magnesium supplementation may help support normal heart rhythm. One of the more absorbable forms is magnesium glycinate. This form is well absorbed and may also help support relaxation by increasing a calming neurotransmitter in the brain called GABA. Other forms, such as magnesium oxide, are absorbed much less efficiently. The typical recommended intake of magnesium is around 400 milligrams per day. Some people may benefit from dividing the dose into 2 servings, such as morning and evening, because the body can only absorb a limited amount at one time. Magnesium does not act as a stimulant. Instead, it supports the body's natural ability to produce energy and maintain balance in the nervous system. When the body has adequate magnesium, nerve signals become more stable and muscle function becomes more balanced. For some people, this may help reduce palpitations. Understanding how minerals influence the heart is an important part of understanding overall health, and learning how to support the body's natural balance may help prevent more serious problems in the future. I'm Dr. David Hayes, and in the next video, we'll talk more about how magnesium may help support long-term heart health.